Welcome to the course on medical credentialing. This course is designed for medical credentialing trainees who are new to the field of credentialing. It teaches how credentialing process is done in a healthcare organization. You must be wondering what are the necessary occupational skills needed in this field for career success. Let's get started. What are the skills required? Well, working on medical credentialing demands knowledge and understanding of the credentialing process. As you will be dealing with a large number of individuals, including doctors, nurses and insurance personnel, excellent communication skills is vital to establishing and maintaining effective working relationships with them. Attention to detail is crucial, as you will be typically performing activities to ensure providers are credentialed or re-credentialed with health plans, care facilities, and hospitals. You will be ensuring timely renewal of licenses and certifications and maintain up-to-date data for each provider. Most importantly, you need to maintain confidentiality of provider information, as tons of highly sensitive provider data and facility records, and so on, will come your way. Remember, any violation of provider privacy can have far-reaching legal consequences of a serious nature. As numerous medical centers and doctors' practices transfer to electronic record keeping, understanding the tech side of things becomes more and more important. Understanding the tech side of things will help in electronic record keeping of provider data. Healthcare in USA today. Problems faced. Medical errors are responsible for the deaths of 98,000 Americans each year, and, by and large, this statistic impelled industry leaders to fight for enhanced standards of competency and greater disclosure of recorded disciplinary actions against healthcare workers. Just like in any other industry, in the healthcare industry too, there is a need to ensure quality services and increase customer, i.e., patient safety. Now, we will look at some of the cases which highlights the errors of omission and commission in medical credentialing. Such incidents open our eyes to the increasing occurrence of medical malpractice and the need to improve the quality of medical care. We can see a glaring need for improving healthcare quality, protect the public, and reducing healthcare frauds. What is credentialing? Let me explain credentialing with the help of a scenario. Here is Dr. Joe. He is very eager to join a leading healthcare organization. To be appointed, he has to submit all the relevant documents. Only after verification and approval, he can join. Yes, it is exactly like the way you submit your documents to the HR for verification when you join a job. In simple words, credentialing is verification of the relevant documents. For credentialing, numerous documents have to be thoroughly checked and cross-verified by visiting different government websites. We are talking about a lot of documents to be submitted and/or updated in timely fashion without any errors. Dr. Joe has the option of doing it himself, but he is always busy attending patients. He hands over this task to Mary, a credentialing CO coordinator who does the job for him. Mary ensures that she collects all documents from Dr. Joe. She verifies and uploads all the documents. The health plan approves and Dr. Joe is credentialed to work with the healthcare organization. Let us look at the definition of credentialing now. What is credentialing? The U.S. Department of Health and Human Services definition for credentialing is the process of assessing and confirming the qualifications of a licensed or certified healthcare practitioner. Credentialing is an essential process that healthcare organizations and practices must perform to ensure those providing services are qualified to do so. It is a process by which health plan evaluates applicants' qualifications before providing services to members. It ensures practitioner has legal authority and relevant training and experience to provide quality care. It satisfies patients that they are in good hands. It helps provider to keep themselves updated. Credentialing workflow. Credentialing life cycle involves profile submission, primary source verification, credentialing committee approval, check certificates, licenses, malpractices, renewals, recredentialing. Let us look at the health plan credentialing process. Firstly, the physician's application and the relevant document is submitted to the health plan through Credentialing Coordinator. Next, the health plan does a primary verification. They go to the government sites and do the verification and generate the report. Once the report is submitted, the credentialing committee members reviews the report. After reviewing, they take the decision of either approving or rejecting the medical staff. If needed, the health plan conducts site visit to the physician's location. After that, the plan adds the physician's location and tax ID numbers to the billing system. Lastly, the physician joins the health plan network. Document checklist. The verification of the healthcare worker's documents are of vital importance. Medical errors are responsible for the deaths of 98,000 Americans each year. The patients confidently place their trust in their chosen healthcare providers, so it's crucial all the relevant documents have to be verified. Let's have a look at the documents which are required for verification. Demographic documentation needed. Demographic documentation include driver's license, home address, social security card, visa, or passport. Licensure and certificates. Licensure and certificates include ACLS/BLS/CPR PALS, must be current. Board certificate. CD certificate. DEA certificate. State medical license, Florida and any additional states. Education documentation. Education documentation include CME certificates, last 24 months. Fellowship, graduate medical school. Internship. Residency. Undergraduate, BS/MSSA. Work history documentation. Work history documentation must be carried out in entirety. CV must include current employer, Access Healthcare Physicians LLC. All entries must include month and year start and end dates. Work gap explanation must include explanation of any gap in employment for a period of 3 months. Must contain month and year start and end dates. Hospital privilege documentation/information. Hospital privilege documentation/information include hospital privilege letters for all current facilities. Last flu shot, last 12 months. PPD results, last 12 months.